guys have quite a little army.
We are across all platforms here. We're not just a TV station. We're digital.
Yeah.
We're news. Wherever those platforms you get your news from. So. All right, Tom, we're good. All right, thank you all for joining us here on Facebook and YouTube and our platforms at KINS 5 Digital. I'm Jackson Floyd, an executive producer here with the digital team. We're joined by Fred Campbell. He is an internal medicine specialist with UT Health San Antonio. Now, Fred, you were just on air on KINS 5 in the 10 p.m. broadcast, just answering some questions about how to stay safe, tips we can do at home, and we're going to go through those, answer some viewer questions, some Facebook questions here. If you have a question for Dr. Campbell, leave it in our comment section here and we'll get to it. First of all, though, I just want to kind of just reiterate what the CDC has been saying. The two big things that they've said in terms of avoiding coronavirus are knowing the symptoms and practicing good hygiene. So what are those symptoms that we need to be looking out for here?
The COVID-19, or this particular coronavirus, when it is severe, typically is associated with a fever in a situation where someone has a respiratory infection or difficulty breathing associated with a cough or other cold symptoms. So those would be the most characteristic parts of the COVID-19 syndrome.
It's been compared a lot to flu-like symptoms, if you will. Is there anything that stands between the two of them? Something that stands out to coronavirus that you wouldn't expect to have with flu symptoms or anything like that?
Unfortunately not. Flu can cause the same kinds of symptoms. Associated muscle aches, for instance, is common with both, as well as the other symptoms I mentioned. And they're both potentially very serious, if not fatal, illnesses.
Now, good hygiene then. I mean, washing hands, avoiding contact with sick people. What are these steps that fall into that category?
Anyone who's out in the public should be aware of people who are coughing or in other ways potentially transmitting infectious agents. So coughing and sneezing is something, of course, to avoid, but it's not completely possible to do so. But hand washing after touching any kind of a surface in a community would be very important. And so washing with soap and water for up to half a minute or using a disinfectant solution are all very important to do frequently when one is in the community.
So the work week starts tomorrow. It's Monday. People are going to be going to work. If you're feeling sick, should you be calling in? Are these steps that you should be taking anyways? What kind of, are there heightened alerts here now that there has been kind of a possible exposure here in San Antonio?
The experts suggest that symptoms such as fever or difficulty breathing associated with a respiratory infection is a good reason to contact a physician, another health professional, a hospital, or a clinic, and let them know that you would like to be evaluated. That way they can plan on preventing a transmission of your illness perhaps to someone else.
Okay, and then I know on my desk I've got some Clorox wipes, some disinfecting wipes. Are these something that can be helpful, you know, wiping down your station at work or anything that you have at home, surfaces at home, things like that? Is that a step to take?
Yes, in fact, surfaces in the workplace are probably more important because a lot of people come into contact with them. At home, usually no more than a daily disinfectant, as long as everyone is healthy, would be perfectly reasonable. Same thing with washing hands, much more likely to reduce infection if you're in the community, in the workplace, and school, and you might want to do that several times a day to be safe.
Okay, and just a reminder too, if you have questions, leave them in the comment section here on Facebook and Dr. Campbell will address those questions. We've seen some stories, just the mass accumulation of, I guess, these health pharmacies and places like that selling out of healthcare equipment, the surgical masks. Do the public need surgical masks when dealing with coronavirus, when going out into the crowded spaces right now? Or is that something that the people who do show signs of the flu-like symptoms or coronavirus, are those the people who need the masks?
It's clear that there seems to be something of a shortage of masks in the community. I even checked that out myself today. Many countries actually require that the individuals that go out into the public wear masks. So that doesn't seem to be common in the United States. but it never hurts to wear a mask. So if you have any inclination to think that you might have been exposed to someone with a serious respiratory illness, whether it be COVID-19 or flu or anything else, you would want to put on a mask, and certainly put on a mask for the person who's actually having the symptoms.
That keeps the symptoms from spreading.
Correct.
That sounds cool.
Correct.
Yeah, I mean, anything else that we're not getting to here that we're not addressing that you want the public to know about coronavirus?
Other than the fact that it is a very similar kind of syndrome to influenza, which we get every year, and the same recommendations, of course, are given to the general public every year about prevention. The virus is spread by particles that are coughed or sneezed into the air, but also can be picked up off of surfaces, at least for a short period of time. So anything that reduces the tendency for us to get those particles into the respiratory tract, into the mouth, would be considered to be important.
Now, spring break is just a few weeks away here. I mean, should people be adjusting any sort of travel plans, anything like that? Or is it just kind of life as continuing on, daily life as we know it for now?
Yes, it's almost impossible to escape viruses such as cold viruses and the flu, regardless of where you go. The COVID-19, of course, is not nearly as widespread, we don't think at this point, in the United States as the other typical wintertime viruses. So I can't see that any restriction in travel would be all that desirable at this point.
Good. So Carlos Martinez, he's asking, the two people that did die in Washington State this week, the first two deaths of coronavirus, I mean, they had other issues with health. It's not just that coronavirus. I mean, is that something that, you know, if you have other underlying issues there, that, you know, this just exacerbates the same way the flu or the cold does?
Yes, that's a very, very important point. Quite often when people die from illnesses such as influenza, it's because they have underlying medical issues, serious respiratory or heart issues, or serious systemic diseases, or are very young or very old. Those are the most susceptible individuals. And it appears that this particular virus, the COVID-19, is likely to behave the same way. So far, there have been some relatively healthy people die, but it's a pattern that seems very similar to influenza.
Okay. Are supplements or vitamins a good idea to kind of help boost the immune system?
Aside from a well-balanced diet, there doesn't seem to be any particular vitamin or other supplement that has been proven to reduce the acquiring of, for instance, the flu virus or this particular COVID-19.
Let me see, I'm just going to look at some more questions here. Shannon Baker, just bringing up the wipes again, the sanitary wipes. Taking them out in the public with you, maybe like to the grocery store, wiping down your cart, are the steps that can help prevent the spread of, you know, any of these flu-like illnesses, influenza, the cold, coronavirus?
Yes, the use of disinfecting wipes, even the use of face masks, if we have them available in the public, tells folks that you're serious about illness and that you don't want to acquire something from them. And so I would say anything like that would be perfectly reasonable, and it's practiced even more frequently in other parts of the world and effectively.
Now, if you're just joining us here, we are answering your questions. If you have a question for us, please leave it in our Facebook comments. Would you mind just reiterating again those good hygiene health tips that the CDC and health professionals are suggesting people use at this time?
Okay. Because the COVID-19 virus is contracted, we think, by breathing in droplets that are coughed or sneezed. It's important to avoid people that are doing that. Also to wash hands, because those particles could conceivably be transmitted from hand to mouth or respiratory tract for at least a short period of time. So hand washing and the use of disinfectant solutions on the hands are both very effective for minimizing transmission, just like a face mask.
Doc, I've got a question. Based on this latest case in San Antonio, how worried should I be if I'm out working in San Antonio, I'm around it? How worried should I be when I go out tomorrow?
Well, I can't speak for the public health professionals in regard to this particular case that sounded like they did a very good job, at least of the initial quarantine. It's unfortunate that there was a positive test, and that's only what I've heard, but I don't know whether that is a real significant positive and whether it really will correlate with a serious infection risk at this point from that individual. Again, I'm not privy to the information that public health authorities have at this point.
Now, we have plenty more information on this story on KINS5.com, on the KINS5 app. Stay in touch on the KINS5 digital side as well, and on KINS5 TV. We're on air right now, the 10 p.m. show. Dr. Fred Campbell, thank you so much for joining us. He answered questions earlier in the show. We're going to get him back on air with Phil Anaya, just addressing some more of these questions that you have. Tips to stay safe, tips that you can take in your daily life as the coronavirus, these concerns continue to mount here. Thank you so much for tuning in. I'm Jackson with the KINS5 digital team, and we'll see you next time.